Defer to Senator Tuberville and allow a colleague to go.
Thank you very much. Thank you for being here today. This is important. I don't think people really know how important it is. I coached for 40 years. I coached in 8 states. I went in high schools all over this country. In 80s and 90s, we had a mental health problem. But after 2000, after the internet and this thing right here came out, it's devastated our kids. And I saw it every day. So this is a huge problem. It's going to get worse before it gets better. Dr. Wright, I'm like you, faith-based, family. I mean, that's how we're going to overcome a lot of this. It's going to have to come through that, but we've got to be prepared and we've got to be able to recognize the problem. Dr. Hoover, for years, I saw kids come play for me, and a lot of them came in early in my career with very little problems. The last 20 years, they came in and they had ADHD. They said they did. And we were giving them drugs right and left. We weren't. The doctors were prescribing them. Do we have a medication problem in this country when it comes to mental health?
It's a good question. And first of all, Senator Tuberville, I want to thank you for your coaching years, because we know that all of the adults, as was said earlier by Chair Casey, all of the adults have a responsibility to take care of the mental health of our young people, including our coaches. I was on a plane yesterday next to a school bus driver and was telling her that she has one of the most important jobs when it comes to actually supporting the everyday experience of our young people and their mental health. In terms of medication and the diagnoses that seem to be increasing, part of it, I would argue, is really that we are just becoming more aware of the mental health needs of our young people. I would say that our medications are far from perfect. In fact, many would argue that they are imperfect solutions to the mental health challenges of our young people. But there is also strong evidence that some of the medications for our children and adolescents, including for ADHD, as you mentioned, and other mental health challenges, have been effective. But they are most effective when combined with other interventions. And that includes mental health interventions provided by licensed counselors, social workers, and psychologists, but also the everyday supports, whether it's from the faith community, from families, or from schools. So it's not a one-size-fits-all approach, and it is not a one-intervention approach. In fact, most of the data would agree that medication combined with other interventions is probably the most effective for some of our most debilitating disorders.
Thank you. Dr. Weiss, we locked these kids down for several years. Fortunately, in Alabama, we didn't do as much. And, we had a study come out not too long ago. We went from 49th to 39th in some areas of our scores improving. We went from 40th in the country to first in the country in graduation rate. Wow. Because we stayed in school. My question is, we've already spent so much money on a lot of these problems. In your opinion, how do we best direct these funds in the future to help with mental health?
I have to, full disclosure, I'm from Alabama and grew up with Auburn football. So.
Oh, you did good.
Yeah.
I should have asked you the first question, too.
The work that I do is addressing, severe mental illnesses that have long been underfunded. We don't have a good track record historically of taking care of those with the most severe mental illnesses, and they really weren't given opportunities to complete school, to go to higher education. So now we have them actually getting well after their first episode with a severe illness, just like you could get well with diabetes diagnosis early, just like you could get well with other major medical problems. And so the cost needs to be reflective and encompass what it takes to scaffold them into these opportunities that they really haven't had before. And that might be more costly than to support a kid with ADHD from high school to college. However, we're just really learning now in the last 10 years what that's going to look like for this country. So because early intervention in severe mental illnesses is such a new concept. And literally, we're talking about the last 10 years of clinics, last 20 years of research.
Dr. Hoover, that I know we're talking about going from high school to college. Half the kids in this country don't go to college. They get a job, they get in the military. How do we help them? How do we evaluate them? Because most kids that go to college get some kind of evaluation through the process of higher education. How do we help those kids that don't go to college?
It's a great question. And when I saw the subject of today's hearing, I was hoping that it would go beyond just college, because we know so many young people don't go on to college. And I would wish that we had better supports in place for them. I mean, I do think it really speaks to the first issue that was brought up, that we need to start earlier. The supports that we're talking about from high school to college are critical, but what's more critical is that we put systems in place from pre-K to K through 12 to actually identify and provide scaffolding and structured support for their mental health. And that doesn't just mean, I mean, I think our young panelist, as usual, said it best, which was we can't wait until there's a crisis. We can't wait until things get really bad to provide services. We need to be doing mental health literacy in the classroom. We need to be putting systems of identification into their hands, whether it's in schools, on college campuses, or in their communities. I think the efforts to support integration into primary care are critical. So for those who do go on to career, maybe not college, they can get some of those same supports in their primary care setting or in other natural settings, whether that's their faith community, whether that's their family. There are many interventions that can support families to better equip them to support their young people, including as they transition to adulthood. So we need to not just put these services in schools or primary care, but we need to put them in the hands of families.
Dr. Wright, you got to comment on any of that about the kids that don't go to college? You see a lot of those.
We do, and just in community in general. And I think, as she was describing, being able to have them access those resources in other spaces, right? There's dignity and honor in all work, but sometimes we privilege, right, this transition, my profession. But being able to make sure that they have access to an affordable health care so that they can afford to take advantage of that, whether it's through state-sponsored Medicaid or private insurance. But I do think that being able to recognize that we all live within the context of our lives and learn within the context of our lives, that there's support in their spaces of work and worship, and they have the ability to talk with their family, because again, secrets are the things that kill us. And so, but yeah, I absolutely agree with what she said.
Thank you.
Mm-hmm.
Thank you, Senator Tuberville.